Kansas is currently experiencing the largest ever reported outbreak of tuberculosis in U.S. history.
Health officials are warning today about the largest outbreak of tuberculosis ever recorded in the U.S.
Since the beginning of this year, there have been 67 symptomatic cases in the state of Kansas.
An outbreak of tuberculosis is now said to be the largest in American history.
Is a stark warning.
Hello everyone, it's Deshan Jayathilaka here and welcome to our health educational channel. Today we are diving into a topic that's seriously important, not just for Kansas, but for the people around the world, tuberculosis or TB. Right now, Kansas is dealing with TB outbreak and it's time to get educated so we can all to do our part to keep ourselves, our families and our community safe. You might think that TB isn't a big deal or that's something that only affects other places, not for America, right? But here's the thing, TB doesn't care where you live, right? So by the end of this video, you will know exactly what is TB, how it spreads, and most importantly, how to protect yourself. Let's get started. So what exactly is TB? It's a bacterial infection that usually targets your lungs, but it can also go further, more for your other body parts too. The infection is caused by a bug called Mycobacterium tuberculosis. Mycobacterium tuberculosis. Now you might wonder, is that TB serious? Well, yeah, it can be. Symptoms include a bad cough that just doesn't go away. Sometimes it includes blood, right? So other than that, chest pain, weight loss, sweating at night, and feeling super tired. Sound rough, right? Yeah, it's rough. And the worst part is that you can actually spread TB without even knowing it, right? You are spreading it. That's why we need to stay sharp and stay informed about TB. How does TB spread? Here's where it gets interesting. You might remember COVID, right? TB also like that. TB spreads when someone with the disease coughs, sneezes or even talks. It's airborne. So when they release those tiny droplets into the air, anyone nearby can inhale them and get infected. But here's the good news. TB isn't spread by casual contact, right? Like touching objects or shaking hands. It's more about close, prolonged contact with someone who has active TB. You might think, oh, I don't have to worry about that. But if you are in a crowded space, crowded place, like public transport, even in a big event, there's always some risk. That's why we all need to be aware, not just ourselves, but of the other people around us. Okay, so let's talk about something that might be a little confusing. Latent TB, active TB. What is latent TB? What is active TB? In latent TB, the bacteria are in your body, but your immune system is keeping touch, keeping check. So no symptoms, no spreadings, and you don't even know it's there unless you get tested. But with active TB, the bacteria are growing and causing the symptoms. It's contagious. So if you are dealing with active TB, you need to get treated right away, right? So if you're not treated, you can lead to serious health problems and you could spread it to others also, right? So the good news is, if you catch early, both latent and active TB treatable. The key is knowing what is going on in your body and getting checked out if you suspect something wrong. Now, how do we stop TB from spreading? First, let's talk about some basic prevention tips, right? So the first thing is first, very simple. You have remember this because we already faced to the COVID-19 also. Cover your mouth and nose when you are coughing, when you cough or sneeze. It's a simple thing, right? But it can make a huge difference in stopping TB from traveling through the air. The second thing is ventilate your space. Open windows, let the fresh air in, and TB thrives in closed, stuffy spaces, right? So air circulation is the key. The third one is maintaining good hygiene. Good hygiene goes a long way. Wash your hands regularly, and if you feel sick, please wear a mask to protect others, not you, right? So the fourth one is, if you are feeling sick, please stay at home until you are cleared by a doctor you have TB or not. It's tempting to power through, but resting and getting a proper care is the best way to keep things from getting worse and protect the people around you. Alright, so if you end up with tuberculosis, don't freak out, right? So treatment for TB is actually pretty straightforward. Once you start it, you can get back to your living of your life, right? Doctors usually give a combination of antibiotics to take for about 6 to 9 months. Yeah, it's a long time, but it's important to finish the whole course, right? If you don't, the bacteria can survive and become resistant to the medicine. Bacterial resistant, I will talk about later, and which make it much harder to treat. And that's how you get something called drug-resistant TB. Drug-resistant TB, which is way more serious. So if a doctor give you medicines, stick to the schedule, right? Don't go to surpass it or don't go to cut down it, right? Also, if you start feeling better early, don't stop to taking medicine. Trust the process. You have to take it until the doctor will tell, now you can stop this. Okay, now let's zoom in on what's happening in Kansas right now. Kansas is dealing with the TB outbreak right now, which means it is more important than ever to stay alert. Health officials are working hard to contain this spread, but we all have a role to play in keeping our communities safe. If you're in Kansas and you think you might be exposed, get tested. There are some 3 or 4 tests. So let's recap. Yeah, tuberculosis is a serious disease, but it's preventable and also treatable. It spreads through the air, so protecting yourself is as simple as good hygiene and avoiding closest contact with people who have already active TB. If you catch it early, treatment also will be highly effective. By staying informed, practicing prevention methods, and getting tested if you need, we can all play a part in stopping the TB in its tracks. Stay safe, stay healthy, and let's all work together to keep our communities safe from TB. Thank you for tuning in today, and don't forget to like, share, and subscribe for more health tips. Catch you in the next video, and until then, stay smart, stay healthy.